Hi everyone, welcome to the webinar. We have quite a few attendees still in the process of joining the session. We will give them just a few seconds to get online and we will begin shortly. Good morning and afternoon. This is Raj and I welcome you to this webinar on CMS 2015 Program Audit Protocols, sponsored by. Today's presentation will run approximately 50 minutes, allowing for questions at the very end. We will put the phones on mute throughout the presentation. So if you have questions, please feel free to type them in the chat box. You can see that it is located on the bottom right part of the. If you would rather send your questions by email, you can write to info@innovare.com. If you have a question for us today and we don't have time to answer all of those during the webinar itself, we will respond to every question via email shortly after the session ends, and we will also send a summary of all the questions that were asked with the answers to all the attendees. Gabe, could I have the second slide, please? Our presenter today is Gabe Viola. He is Senior Vice President at Innovare and is responsible for the solutions and services. He is a leader in healthcare operations with over 30 years of experience across multiple programs, commercial accounts, groups, plans, and at organizations such as Blue Shield of California, Molina, and WellPoint. Some of his recent achievements are listed here. Just a few of these are improving rating from 3 to 4 star and maintaining it for the last 3 years, achieving a 100% score in the CMS validation audit, and achieving the highest audit rating from CMS on the OEV process for 2014. It is my pleasure to turn the program over to Gabe. Gabe?
Thank you, Raj. I appreciate that, and good morning, everybody. Excuse me. I hope the information we provide is of value and helps you in your preparation for your audits in the future. We'll be going over 4 main topics. If I can get this to work, we'll go over 4 main topics. There we go. The CMS Program Audit Protocol and Changes, just a general discussion. The importance of correct universe. The old rule of monitoring is, and then the new beneficiary investigation analysis and the timelines that is due on. So those are the main topics that we'll be discussing. Also, towards the end, we will be talking a little bit about some tips on a successful audit. And then we'll have a question and answer process as Raj explained a few moments ago, and then we'll go from there. So anyway, I know you guys are all busy and you've got a busy workday ahead of you, so we'll go ahead and get started. As you all know, CMS announced the Medicare Advantage and Prescription Drug Program Plan Audit Protocol Changes and announced that all plan sponsors will be considered for the audit, even those audited during the previous 2010 to 2014 cycle. CMS stated that it will continue to select plan sponsors for audit based on risk as well as other factors. Additional factors considered include whether the plan sponsor has previously been audited, whether the plan sponsor is in its first 2 years of operations with no prior affiliation with Medicare programs, and whether the plan sponsor has a large percentage of MA or Part D enrollment. Also, they've announced, as in previous years, that the 2015 audit process will be utilized to measure outcomes in the areas of Part D formulary benefit administration, Part D coverage determinations, appeals and grievances, Part C org determinations, appeals and grievances, special need plan model of care, and Part C and Part D compliance program effectiveness. So no great surprise with all that there are, again, also many modifications have happened in the past year. Modifications were made to the universe timeliness test and universe submissions. CMS has requested additional universe to test this data. In the past, the request was for a consolidated data in one spreadsheet. However, CMS found it difficult to test timeliness in this manner. This makes it crucial to verify that all universe requirements are prepared and reviewed in an annual manner. Compliance program effectiveness has also been modified. The 7 elements are going to be tested using a tracer process. CMS is still going to be doing the interviews, but they will be sending tracers to test the elements to make sure that the compliance program is working. They've also proposed the new test elements will be piloted starting mid-year, and that's medication therapy management, MTM, and the provider network adequacy. We won't be talking too much about these two today because these portions are pretty new still, but we will be moving forward with it at a future date. Timing has also been modified on the program audit. If a sponsor is selected, it will receive a letter of engagement 6 weeks before the start date. Upon receipt, the plan sponsor has 3 weeks to submit the universe to CMS. CMS did increase the time allotted to submit the universe, but that's because they expect it to be perfect now. Audits will continue to take place over a 2-week period, with the first week being through a webinar, and the second week will be on site as it's been in the past. The changes, again, are a result of experience during the previous program audits, as well as factoring in the survey responses provided by plan sponsors. And as CMS always goes, the goal is to audit the program to make sure that the plan sponsors are in compliance with meeting the members' needs. With that, I just want to talk just a few minutes about the enforcement actions. We all know that the penalties can be either, civil monetary penalties, intermediate sanctions, suspension of enrollment for a period of time, marketing payments. And CMS can also determine that the infraction may cause termination of the program. Penalties the penalties are done at the contract level, but again, we all know that prescription drug PACE or cost plan contracts. So far, for 2014, there were 48 disciplinary actions in place. 6 were sanctions, 42 were monetary penalties imposed. So far, the grand total is at $8.8 million. The violations found during program audits, issues of late annual notice of change, incorrect network pharmacy directories, and enrollment processes. The average monetary penalty per item was about $200,000, the highest being $1 million, the lowest being $20,000. Now, this is quite a jump from previous years, and it's a trend that's not in our favor. In 2012, the total monetary penalties was $1.1 million. In 2013, it was $1.13 million. 2014, it rose to $4.54 million. And again, 2015, so far we're at 8.8. That's over a 300% increase in the last 4 years. Sanctions imposed were 6. Violations found during the program audits were the result of 4 of them. Violation enrollment requirements due to state-imposed suspensions of enrollment, that was 2 of those. The average duration has been about 292 days for these sanctions. The limited marketing and enrollment period will end once CMS validates that the corrective action has been taken place and determine that the sponsor has corrected the deficiency. And we all know that it's not only just the sanction, the loss of being able to enroll. That's it has not only a loss in revenue, but corrective actions and all the work that has to take place to get the public perception back in place, so you can keep marketing forward in the way you've been. Now, CMS has also made it a little more expensive, I guess, for all this. In the conference, if any of you attended, the slide will be similar to you. CMS is requiring now that in order to get out of sanction or out of the validation process, you actually have to hire an outside agency to audit to make sure that they validate the corrective action has been taken and prove remediation was successful. And we all know that that's again another portion that makes it that much more difficult as we go through this processes. I want to take just a quick moment to go as we continue forward. I just want to talk about the importance of the correct universe. As we talk, the portion is one of the key things in the correct universe is making sure that you start off your audit in the right path. CMS has made several modifications to the audit process itself. Sponsors will be given additional time to provide requested universes as compared to prior year's process. Audit notice will be sent 6 weeks in advance, with submission of the universe required 3 weeks before the scheduled audit start date. This increase in time, however, is being balanced by a more punitive response for sponsors that cannot provide accurate data within the given time frames. CMS has created new record layouts for submitting universes and new requirements around those universe submissions. The major record layout changes are mainly on ODAG and CDAG. There is now a limit on the number of resubmissions that will be allowed by CMS. Not having the accurate universe can drastically affect your score. Again, if you can't get the universe in from the beginning, you start your audit on a slow note from the very start. And again, we know that the scores can adversely affect your star ratings and past performance. Some of the challenges that the plan is going to have with all this is an increase in plan susceptibility to universe errors due to the template changes and the sheer numbers of universes. Right now, if I'm not mistaken, I think there's 13 for ODAG and 15 for CDAG versus what it used to be. That way they can monitor better the timeliness of the issues being reported. Assessing the extent to which previously programmed queries need to be overhauled, including more complex queries with filters, increase the risk of these universes being put together properly. An increase in time and cost to strengthen the quality assurance process for the universe, and the risk of the quality assurance testers may be blinded by the cut and paste shortcuts and subtle differences between templates. So again, the templates are supposed to be standardizing, but again, they're different between one to the other, and we've got to be very cautious about how we go about getting that information put together for the audit process. Addressing new data elements, including the need to query multiple systems and merge the data for universe submissions, and even modifying workflows systems to accommodate additional data elements for tracking and reporting. It's hard to report on something that you don't have the data for. Therefore, you've got to make sure that the data elements that are being requested by CMS in their universes are available. With the new submission requirements, sponsors will have a maximum of 3 attempts to provide a complete and accurate universe. Whether these attempts all occur prior to the entrance conference or they include submissions prior to and after the entrance conference takes place. However, 3 attempts may not always be feasible depending on when the data issues are identified. If multiple attempts are made, CMS will always use the last universe submitted. The 3-strike policy for failed universe submission starts with the resubmission of the universe without corrective action, moves to the issuance of an observation, and finally an icon for every condition that could not be tested in the universe. So again, you've only got 3 shots to get it. The first time, they'll let it go. After the second time, they will notify that on the final report that is an observation, that you were not able to provide the correct universe after 2 attempts. If you have the misfortune of having a 3rd attempt fail, then the sponsor will be cited with an ICAR for the condition related to the inaccurate universe. Okay. Again, the biggest impact, I believe, is going to be on the ODAG and CDAG. The universe for ODAG went from 3 to 13, and on CDAG it went from 3 to 15. And again, a number of changes were made to those universes. So CMS announced at the June 16th conference that it will apply the requirements when the data is so incomplete or inaccurate that the auditor cannot conduct the audit, or for timeliness, CDAG or ODAG, when the auditor is unable to confirm the accuracy of the dates and the times applicable to the time frame being tested. But let me tell you that blank data elements are fatal, especially when it comes to the timeliness portion. The dates from and to, they're having very little room for error on those portions. Again, the specific area of concern is failure to timely resolve grievance and notification of beneficiaries of the disposition of the grievance. In fact, over the last several years, that has been the biggest outlier for most of the plans. We've had a few clients that have really had a difficulty with this process. In fact, I would say that even when the universes aren't submitted correctly or properly, they're still going through the audit. They're still making you go through all the items that you have identified on the universe, or all the ones that are selected, and you're already on the back end. If the universe isn't suitable, it doesn't provide the elements, they are issuing ICARs for that, and you're starting off with a fail on the audit at that point for those elements, and that's something that's going to be very difficult to make up. I'm sorry, if you just give me just a quick moment here. All right. We're going to go forward and go through a little bit about, monitoring is not good enough. Again, a very loaded statement, as you can see. One of the issues we have been seeing in recent audits that have been conducted is that CMS is truly pushing on the member impact and ensuring that the plans are doing everything they can to make sure identified problems are resolved and actions taken to prevent it from affecting other members. I was part of an audit last year, and where not only are they making, through the audit process, are they making sure that you're doing what you're supposed to for that member, but they're wanting you to make sure that you go the extra mile for that member. One of the audit sequences that we had as an observation was the fact that even though we resolved the case in a timely manner, the observation was that we did not follow through and ensure that the member actually saw the physician after we had made the appointment for them to see the specialist. So that is the extent that CMS is pushing for the plans, to take the member's perspective and making sure that the members actually receive the care that they're looking for. I'm also aware of other organizations that have had to go through extremes to making sure that the error that's identified is corrected throughout the plan, throughout all its contracts, making sure that if you've identified it in your, plan A, that it, did it affect your plan B, your plan C, and even has it affected your other contracts, moving forward. Now, we all know that it is the responsibility of the plan to make every effort to stop errors from happening. You'll now need to demonstrate that the activities you have taken make sure that those efforts are in place and that it applies across lines. So just because it happened on your, senior plan 65, did it happen on your preferred plan, on your other programs? Are your copays all correct across the board? So once you identify it in one place, they're asking that you make sure that you identify it in all and prove the steps that you took to ensure that that identification has taken place. That we needed to do to provide a good corrective action is to show effective training and education, that we had a plan in place and that the staffing was trained and educated in the process. Systems for monitoring and auditing are in place. We're able to identify the different issues, go through them, properly log the call, and so forth. Promptly responding to compliance issues, the timeliness was there. If we did identify something, we self-reported. The FDR oversight, et cetera, et cetera. Again, one of the key elements that this change brings in place is that you now have to take a look across all your elements, across all your plans. If it was wrong in Plan A, did you verify it in Plan B? One of the things that makes it difficult for plans is that in many places they're actually separate databases that you're having to go across and look. The elements inspection and pharmacy, have the copays been set properly across many different levels? If so, how many members were affected by that? What information did you have to provide? What information is being sent out to the members to ensure that the correction has taken place and the members are not, adversely affected over the long term of this? You're now going to need to know and show that the other plans that you're responsible for do not have the same issue, and that if they did, what remediation has taken place for those plans, even if it's outside of the audit elements. And that leads us to talk about the new beneficiary investigation analysis portions. Again, I'm not quite sure that I want to say this is new, because I think that a lot of us in our plans and organizations kind of had gone through this before, but now it's being made formal and official. So in what we just talked about, how we need to make sure that we monitor across, one of the things that is being requested of us is literally that we pre-audit issues be identified. requires that the plans identify their own issues. Plans are required to report the disclosed issues to CMS. The format for reporting these issues is more detailed and includes resolved and unresolved problems. There is a time limit for submission of this report and consequences if the time frame is missed or if a plan misses an issue altogether. One of the things that I think that people underestimate when it comes to the pre-audit issue summary is that when CMS comes and audits, the last thing you want is for them to find an issue that you are not already aware of or have not already taken appropriate action to try to remedy. And that's where I think this report becomes very crucial. And again, the timeline for providing this is pretty short. So these are one of the things that you need to get going early and often as you go through this process to make sure that you're taking a look at your different audits, making sure that you have the appropriate focus and that you have the ability to identify these issues and to remediate. The pre-audit summary requires plans to report and disclose submitted to CMS ongoing. It's not a one and done deal. The format for reporting these issues is more detailed. And not only are you having to identify it, but then you're having to report by issue the beneficiary impact. Now, CMS has put out a format for each of these, and I'm not going to go into that completely. It's available on the CMS website, and it came out with the February notices from CMS. We do have links available if you'd like to ask that we can provide so that you can get to those if you haven't gone through them already. Again, the challenges is going to be developing the BIA queries in multiple places. Having adequate staff and resources to carry out the analysis. With all this requires resource and efforts and time submitted to this process. Submitting adequately developed and accurate BIAs on time. Again, just like the universes, they're expecting that this information be usable for them in their audit and their process. CMS limits the number of attempts to provide the accurate BIA. And again, a range of consequences for failed submissions applies pretty much just like as if with your universe. I don't want to go into a lot of detail onto what the beneficiary pre-audit issue summary requires, but as you could tell, even at the summary level, it's asking for the number of members impacted. Was the issue previously disclosed to CMS? When you disclosed it and who you disclosed it to? The description of the remediation for negatively impacted beneficiaries. When did you fix it? When did you identify it? And again, a detailed action on what takes place will follow. The BIA is also much more detailed. Again, it has the same reference issue number as with the pre-audit summary, and it goes into a lot of the detail. The benefit impact analysis in the CMS format must be submitted for each of the issues on the pre-audit issue summary and for certain issues discovered during the audit process. So if they find something, you'll be doing the same analysis for those pieces as well. Again, the challenge for us is going to be able to develop these BIA queries across multiple systems if you're using multiple systems, multiple databases. Having adequate staff and the timelines to turn it around, especially once the audit notice has been received, and submitting adequate, developed, accurate BIAs on time. Again, there's no joke on this one. while we're talking about the BIA, I figured it'd be a good time to talk a little bit about the audit process in just a few moments. Once the notice is received, you will have actually 5 days to provide a self-identified pre-audit issue summary. Again, CMS is limiting that to 5 days because we're already keeping track of the issues prior to the audit notification, and so it's just a matter of compiling the information and putting it out to them. Followed by the BIA for each of the issues within 15 days of the notice of audit. That's also about the same timeline that the universes do. Yeah. On week 7, they'll be conducting the webinar audits with the different areas, the CDAG, etc. The on-site audit takes place. And then the dreaded wait, the 60 to 90 days wait till you get the audit response about see how things went. Again, I hope I've put this together in a manner that you're seeing how the timelines just flow one to the other. You know, the fact that they're looking for additional monitoring, the fact that they're asking for the pre-audit reviews, pre-audit summary shortly after receiving the notice, the fact that we have to do the beneficiary analysis on each of the issues pre-identified, and that we are going to have to do those issues that benefited investigation on each of the issues identified by CMS during the audit process. All that takes place in a very short amount of time and makes it very difficult for any health plan that is not prepared in order to meet the timelines. And so far, some of the first findings is that plans have not been able to meet the timelines. We have a client that had an issue with this universe submissions and getting the third submission in properly. We know of another group that had an issue with the BIAs and not having all the detailed information that CMS is requesting on the beneficiary investigations. So it is crucial that these things start now, and to be honest, as you move forward, as you go into your preparations for the audit process. As far as the audit process goes, these are some of the things, and again, a lot of you will find not a whole lot of this is rocket science. You know, as I mentioned earlier, you know, the chance of you being audited, you know, is highly likely. Sponsors audited in the previous audit cycle will be re-audited in this new cycle. So you don't get a pass because you just finished an audit last year or the year before. Sponsors of high star and low star ratings will be audited. Sponsors that have never been audited previously, sponsors new to the program, and sponsors that represent a large portion or percentage of the MA or Part D enrollment, you know, will be targeted for the audit this year or this coming cycle. Yeah. You know, since 2012, CMS has released 4 memorandums summarizing the common compliance issues found during its program audits, and has stated that the agency continues to find many of the same common conditions or findings during its yearly program audits. For 2015, CMS is expecting to escalate the consequences of finding conditions from one or more of these memos, and substantial failures may result in additional enforcement actions due to these aggravating circumstances. The bottom line is CMS is making it clear that they've been public about the information that they found where plans have had issues in the past. So one of the things that you need to do as you prepare for your audits is make sure you're familiar with the HPMS memos, the CMS fraud alerts, best practice from CMS audits, high-risk pharmacy and high-risk prescriber assessments. You need to incorporate these into your work plans. And one item I think that a lot of folks miss sometimes is that you need to incorporate these into your policy and procedures and make sure that they're reviewed and updated with current audit requirements. The last thing you want is to try to be sitting there telling CMS that you're doing A, B, C, and then provide a document that says you're doing E, and F. So those are some of the crucial elements that you start off with. You need to ensure your universe can be pulled quickly and do it often. Don't wait. I actually took this line from the CMS audit, CMS conference that occurred on the 16th. One of the suggestions is you should be running the universe, monthly, if not quarterly, to make sure that A, you can run it and that it works properly, and B, it identifies the issues that you will be encountering once you do go into an audit. Provide samples for internal audits and practice your webinars. As I'm experiencing here myself as I go through this, it's very different to be going over the process or going over what you're going to present to CMS, when you're all in a room sitting together, versus when you're facing a screen and you're not sure how the audience is reacting to what you're saying. So that is one of the things I think is key into a successful audit, is to make sure that you practice. Review frequently by department and Medicare compliance. You need to be as transparent as possible to compliance and to your own operations and to yourself. You need to make sure that you're frequently reviewing the different things that you're supposed to be doing, the different rules that you're supposed to be following, making sure that you put into your workflows, some of the things that have been identified in other plans as a best practice, or avoiding some of the failures that they've had in the past. Base your internal audits on the CMS audit protocols. Use it as another tool to confirm universe data is correct. Practice the department audit team with the department audit teams. Again, make sure you use the CMS guidelines. Internal audit should be more rigid than when CMS comes out. CMS wants 95%. Try to achieve 97. Make sure that you're pushing that in a way that it drives your success. Build some cushion if you can into your process to allow yourself to get that extra portion. One of the things, and I'll be honest, I'm as guilty as anybody else on this one, is not to forget those areas that are not specifically in the audit protocols, because you're all connected. If you're receiving, mail down in the reception, and the receptionist keeps it on her desk for 3 days before she gets it upstairs, to your appeals and grievance department, you're falling behind the 8 ball right off the bat with that process right then and there. Those are some of the key things that you need to make sure that you've got in play as you're getting ready for an audit, as you're getting ready to make sure that your CMS protocols are in place, to make sure that your timeliness is aligned with what you need to be doing. Develop your BIA queries early. Again, don't procrastinate. I talked about the universe. I found that the BIAs are in many ways more difficult to get put together, to get out. Very few of us have one system that keeps all the information in one place. You have your customer service monitoring systems, you have your appeals and grievance with their systems. Many times claims is a separate system altogether, whether it be Fastest or QNext or any of the other systems that are out there. You've got to make sure that when you're running your BIA queries, it's going to take several queries per issue to identify the trends, to identify who's been affected, and then to prove, what has taken place in order to remediate or to correct those activities. Again, if you're using multiple systems, if you have your delegated model that has things on one portion versus another, you've got to make sure that you've got the multiple systems all united so that when you do your reporting is consistent, is accurate, and is complete. You need to educate your key managers and executives on the impact of the protocol changes for support and buy-in during the audit process. You need to identify and prepare sample universes, as we mentioned. Prepare questionnaires and coordinate responses within your own departments, just like CMS does for us. Take those same avenues and move forward with that. I'm a big proponent of conducting a CMS mock audit, or an abbreviated one at least. Carry out CARs and ICARs on findings and validate remediation efforts yourself. I mean, these are some of the things that CMS is actually expecting that we move forward with and that we achieve. I strongly advise that you report things up to compliance as they come across. You use them as a support properly into the eyes of CMS. One of the things that I know early on in my career that I've missed is where you don't include compliance as uniformly as you probably should. They're a resource. They have a view into what CMS is looking for. You need to take that into account as you put together your process. So I'm a full proponent of involving them as much as possible, and in some cases more than some folks like to. Having a monthly universe, for many plans that they're actually doing it, it's much more stressful for the team who is not able to pull and review the universe monthly than it is for the ones that can do it all the time. I mean, if you've pulled January, February, and March, and you already know that it's working properly, you already know what is trending, you have a heads up onto what's going on, all you have to do when it's audit time is just to add the new month and continue forward from there. It gives you a huge head start into getting the items put together in order to get there. The one thing, though, I do want to caution everybody is this isn't a race once the notice comes to you. Regardless of how you practice and prepare for the audit, once you get the notice, if your company's not doing it correctly, your audit's going to come across and show that. If you're averaging, 96 hours on expedites, practicing and doing the demonstration isn't going to get it down to 72 for you to pass. Those are some of the things that you need to get put in place. And the same, if you're not doing it correctly, that's unfortunately going to show as well as you move forward. These are some of the things that early intervention, early process gets you ahead of the game, gets you moving forward, gets you going into the right direction as you head forward for your audits. With that, it looks like I'm coming up to a close a few minutes early. We're just about at the 45-minute mark here. So Raj, I guess I will be turning it over to you at the moment to see if any questions have come across.
Okay, thanks, Gabe. Yeah, we do have several questions, and let me take up one that came up early in the presentation itself. This question is, if you have a finding on a previous audit and remediated issues at the time, However, the issue is identified again during the current audit. What is CMS's protocol? And then there's a kind of a follow-up on that, which is, will it escalate the corrective action or go directly to disciplinary action? Okay.
Well, that's a good one. Nothing like putting me on the spot right off the top. Again, it really is going to depend on the severity of the findings. To be honest, I mean, one of the things is you never want a repeat with CMS. I unfortunately have had my share of those in the past, and usually it a little more expectation on getting it fixed the second time, a little more urgency. I've seen them. I don't want to say push them into the ICAR status right off the bat, but I will say that they do monitor more extensively. The burden of proof is going to be even greater on you to show that the remediation is taking place. Now with the requirement of all remediation requiring an external audit to validate that that remediation process has taken place, I think those protocols will be put into place and even more highlighted as it goes forward. Other than that, I mean, I think that the you run a. Okay, Raj.
Okay. So let me take up the next question. Actually, this is more general in nature, but several participants have asked about this. Are there specific restrictions on the consulting or audit firm that can be used to do the corrective action and validation? Okay.
Okay. Restrictions on the audit firm, I haven't heard of them having to be off of a particular list or anything of that nature. I think that when you're looking for an audit firm, obviously you want somebody that has some reputation as being able to speak to the issues, or has audited in the past, or on the CMS recommendation, or one that is highly utilized. The one restriction that it is required is if you have a firm help you with the remediation, that same firm cannot do your validation for you. So you really do need to have a firm outside of the corrective action group validate that the processes have been modified, validate that the remediation is true and that the members have been made whole if they were affected, something of that nature. So the real key to that is if you're using firms that help you with the remediation, you're going to have a second firm help you with the validation of that process.
Okay, great, thanks. And this is again a general question more related to the presentation itself. Several have asked, is there a PowerPoint for this presentation that we can access? So yes, we will make the presentations available to all the attendees. In fact, the recording itself will be available on the website, and you all could access that, and we'll send you information on how to access it to all. The next question, Gabe, is a two-part question. It goes, have there been plans that have been able to effectively prove that the issue does not cross over to the other products? And the other part is, how do you gather the data effectively to comparison?
Well, there have been, to the best of my knowledge, there are plans that have been able to make the crossover reviews. I mean, reality is it is just a matter of doing queries into the different products to make sure that your elements are being identified properly, making sure that and I'll use a simple one. If your copayment was incorrectly set, on your PPO1 plan, that it's as you go into the other plans, that it is actually reflected in those as well. To be honest, though, I think that one of the best ways of gathering the data is actually to have a where the key information is kept as you move forward. I mean, I know there's software products out there, whether it be through Innovare's product suites or TriZetto's or anybody else's that have that ability to gather that information into one warehouse. I think that makes it the easiest way to go about into gathering information like this. I do know that is difficult for plans. So I think the real trick is to properly query the different systems that are being effective so that you can get a compiled, accurate listing that's consolidated.
All right. Great, thanks. And let's go to the next one. This is, let me pick one. If you had to focus on one thing in particular to start now in preparation for a future audit, what would you recommend?
All right. For me, I'm going to say there's two items I think that you need to be prepared with. If you're talking about, if they're asking specifically for a future audit, I would say the universe. If you can't get your universe in place properly up front, you're behind the 8 ball already, and I think that is, for me, the number one. You want to start your audit as proper as possible in order to get the best results you can from that audit. But even before the audit, even before your preparation of the universe, are your P&Ps in place? Have you met your compliance standards? Are you moving forward with those elements at that stage? I think that taking the CMS memorandums, making sure that you're not making the same mistake somebody else is. Remember, if they've caught somebody else with it, they're already looking for it in the next plan. So I think those are some of the crucial pieces that I think get missed sometimes as people prepare for their audits. Okay, Raj.
Okay. These are some of the questions that came repeatedly. There are several questions, but what we could do is we could answer them separately via Q&A because they are more specific to situations.
Okay.
Let me look a little more and see if there are some general questions. Bear with me, I'm scrolling down. Okay, there's several, Gabe, that I see that are specific to the firm. But there is, I can just paraphrase this one. There are several people who are asking, what is your advice for a health plan?
My advice for a health plan?
Yep.
Well, I think for advice for a health plan as you move forward, getting your data elements in place, making sure that you're able to report properly, that you report often, whether it be just internal reports yourself so that you're aware of the situations that are going on, making sure that you have a tool that properly tracks the different elements that CMS is looking for, whether it be the timeliness or the accuracy. I think those are the things in place. You need to give your operations areas and your compliance the pieces that they need to be able to properly respond.
Okay, great, thanks. Okay, checking again, going down the list. Give me a moment here. Okay, it looks like several of these are in specific questions. Again, all these specific questions will be answered one-on-one by email, and we'll respond to you. And I think I think that's all we have time for today, and we should conclude. I would like to thank you, our audience, for joining us today. Thanks to Innovare for their sponsorship, and Gabe, thank you very much for the presentation. We'll leave the meeting on for some time, so if you have questions, you can send those to us. All of you will be provided a summary of the Q&A session, and we will also share the link to the presentation that you can go and download if you need it for reference. Now we conclude the webinar. Have a good day.
Thank you, everybody.
Thank you, everyone.